Hello, and welcome to today's audio training for new nurses. My name is Wendy Denyu, and I will be your speaker today. I am part of the Quality Improvement Council at this facility. Some of the things that we do are to implement new policies and report pertinent data applicable to quality indicators. The Council has determined that it is beneficial to nurses newly hired at this facility to discuss nursing-sensitive quality indicators, which is what we will be further discussing today. This is a relevant topic to healthcare as it helps to establish the guidelines for providing evidence-based care in addition to implementing policies for our facility that help to provide the highest standard of care possible for our patients. The American Nursing Association created the National Database of Nursing Quality Indicators, or NDNQI, as a means to keep track of and have reports ready on the quality indicators that are influenced by the nursing profession. This resource acts as a database that assesses nursing performance in relation to patient outcomes. Data from this can be extracted to compare one facility to another on several levels, ranking from locally to nationally. There are 3 types of categories monitored by the NDNQI, and that is structure, process, and outcome. It should be noted that since implementing quality indicators, that there has been an improvement in regards to patient safety, as evidenced by Koch in 2020. When in the presence of patients, nurses should always be thinking in terms of patient safety, and nurses should be aware of the type of setting that they are in and know what quality indicators will be monitored, as not all types of settings will follow the same indicators. While working in healthcare, many issues can arise on a daily basis. One such quality indicator that happens in the healthcare setting is patient falls. For this presentation, I will further discuss patient falls in the healthcare setting. Patient falls can be described as process and outcome. What happened to cause the fall? Could it have been prevented? What was the patient's outcome? It is estimated that for every 1,000 hospital admissions, the incidence of falls can range anywhere from 3.3 to 11.5, according to Kangeny in 2018. This is a significant number, as this is happening in the acute care setting where patients are already being treated for what initially brought them to the hospital in the first place. As nurses, part of our job is to assess patients. From the moment that they arrive to the facility, we should be assessing the patient to observe if they are likely to be at risk to fall. There are different tools that nurses can utilize to help determine if a patient is at risk of falling. One such tool is the Morse Fall Scale. This tool calculates the patient's risk to fall on factors such as mental status, urinary issues, medications being taken, and patient age. The lower the calculated score, the less likely the patient is to fall. Another tool that can be utilized to assess a patient's likeliness of falls is the Johns Hopkins Fall Risk Assessment Tool. This specific tool is slightly more in-depth with discussing the patient's mobility and if they have had previous falls. Studies have shown that Johns Hopkins Fall Risk Assessment Tool is a more accurate tool to determine if a patient truly is at risk of falling, according to Kim in 2022. I recently spoke to a charge nurse in the acute care setting named Kat, who discussed the difficulties associated with preventing patient falls. Kat made mention that prior to COVID, there was more hospital staff readily available to help prevent falls in the hospital setting. She reported that since COVID, there has been less staff, but the need to prevent falls has not changed. When there was more staff present, she discussed how often there would be an aide who would sit with the patient and be readily able to assist to help prevent a fall. She further discussed how at this time there is a lack of aides within the facility to provide this type of service. As a means to prevent falls, there has been a variety of interventions utilized to help prevent falls and provide a safer patient outcome. When possible, patients who are at risk to fall have rooms that are close to the nurse's station. When allowed, there are bed alarms in place that will alert the nurse when a patient is climbing out of bed. This measure allows the nurses to hear the alarm and are close enough to intervene, as opposed to if the room is further away and not being able to make it in time. Another intervention that Kat referenced was the hospital's investment in a virtual monitoring system. This was purchased after data was collected showing that further interventions needed to be utilized for this quality indicator. The way that this works is that there is a device with a camera placed in the patient's room where someone watching the patient from a remote location. The person watching from a remote location is able to speak to the patient from the device and help redirect them to prevent falls. They also are able to call the nurse and alert them if there is anything happening that could cause a fall. While Kat said that it is much more ideal to have someone with the patient, she is grateful for the tools provided that can help prevent falls from occurring. Utilizing technology such as this helps to promote evidence-based practice by implementing technological interventions that promote patient safety. When a fall does occur, an incident report is completed and data is collected for the hospital to review by a committee to help determine if any further interventions can be put into place to help prevent incidents such as this from occurring. While accidents can and do happen, providing interventions associated with the cause of the fall can help to prevent them. For example, if someone is falling due to having to use the bathroom, a toileting schedule can help to prevent them from climbing out of bed unassisted, according to Kanjni in 2018. This can be a simple yet effective method to promote patient safety. If a fall does occur, nurses should always provide thorough and accurate documentation of the incident. Our goal with this is to learn from these experiences and extract the data that can help us to facilitate better patient outcomes in the future and to change what we as a facility can do differently to better support our staff to help provide better patient safety. I hope that some key takeaways from today's presentation will be to always assess your patient to ensure safety and to help provide the appropriate documentation. If we are not provided with the appropriate documentation, we may not know that there is something that could be done differently to help with safety measures. We are here to support our nurses and hope that providing information on this example of a quality indicator reinstates that mission. Please feel free to reach out to myself or any other member of the Quality Improvement Council if you have any questions or suggestions on things that we can do to help provide a better experience for those that we serve. Thank you so much for listening to today's presentation.